Well, fevers can be scary and stressful for parents, but it doesn't have to be. And Dr. Christina Merritt, physician and owner of Merritt Pediatrics, is here with some helpful advice. Okay, doctor, a lot of parents may panic when their child has a fever,
Yes,
okay?
they do.
So break that down for us.
So what a fever actually is the body's natural immune response to raise that temperature to help their body fight off an infection. So it's a normal response, not necessarily a bad thing.
So what should parents do when their child has a fever?
So we always tell people, rest in fluids when you have a fever. Rest because your body is fighting, it needs more energy. And fluids because actually when you have a fever, your temperature has risen, your water needs have increased. So everybody needs more fluids when you have a fever going on.
Okay, so I just know this from talking to my other friends who are moms also, and some of them may panic even when their child has a low-grade fever.
Sure.
Okay, but also in that same breath, I know that my daughter at 102 isn't like me at 102, where I would be just down for the count.
True.
Okay.
True. Children can handle higher fevers way better than us adults can, and just in general, the temperatures are higher than ours are. So if you were to check your temperature on a random day, the child is going to have a higher temperature. They handle those higher temperatures, and they can rock some pretty good fevers. Children can get 104 fevers with a virus, and that's completely normal.
And so it's important to not panic, right? Which is
number one
like telling
piece of advice.
Don't think of the elephant in the room, right? But you try not to panic.
Right.
So if a parent notices a fever, what are the steps they should take?
Well, number one is to make sure that the child is staying hydrated. And so I tell parents to look for three things: tears, spit, and pee. That's a good indication of your hydration status. And like I said, the other good thing to watch for is making sure they get plenty of rest, which is sometimes hard with a 2-year-old running around the place. So try to get them the rest.
When your child has a fever, are there any besides the Tylenol and ibuprofen, say it's the middle of the night, and say it is 103, what else can parents do?
Well, so for the first thing is I would say choose either Tylenol or ibuprofen. I don't like alternating those two medications because they're different doses, they're given at different intervals, and it's easy to give too much of one or the other. So I would say if you're going to be giving Tylenol, give Tylenol, give it 20 minutes, and it should come down a little bit. It may not come all the way back down to normal, but it should come down. And if the temperature is not coming down, then you could try a lukewarm bath.
Okay, a lukewarm bath. Okay, and then when to call a doctor like you?
So number one is if your parent instinct says that you're concerned, that's when you should call the doctor. And my advice with fever is always going to be, you're going to treat the child, not the fever. Your job as a parent is to keep your child comfortable and support them while their body is doing what it's supposed to do while it's fighting off the infection.
And also, how is your child acting, right?
Right,
It's
exactly.
important.
If your child has a temp of 101 and is running around playing, cool, let them be. They don't necessarily need any medication. But if they have a temp of 101 and they're laying around and moping and grumpy, absolutely give them some Tylenol or ibuprofen.
All right, Dr. Christina Merritt, thank you so much with Merritt Pediatrics. For the care you deserve, all you have to do is call Merritt Pediatrics at 210-934-3911. And where are you located?
I'm on Blanco near Bitters.
Blanco near Bitters. All right, or for more information, just visit merrittpediatrics.com.